Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to Between Two White Coats. Today we're going to talk about insurance. So we're going to hopefully make it actually a positive and try to keep it this one a little shorter than usual. But we get a lot of questions from patients. We have a lot of questions often about insurance because there are a million plans. And so we thought about kind of turning this episode into what does your insurance actually do for you besides what you don't think it does? Because often you'll get like, oh, well, my insurance won't cover this or my insurance won't do this. And so even though we have opinions about insurance, it is there to help you, right? It's supposed to help you and you're paying for it and it's a service you're paying for. And often you may not have, your human resources department is often not asking you what you would want. They're picking a plan for a company. And so getting familiar with what you actually own because you are paying for this. Yes. And so I did, we have health insurance not through here where I work, but my husband's job. And so several years ago, I started looking into, because they were sending me these emails. And so I went on and looked and I was like, oh, well, we do our annual wellnesses. And if you do that, then you just click this little button that through the website.
You get incentivized.
And you get incentivized. And so sometimes I don't think people realize that. And I'll tell patients that.
Absolutely.
And so I think that we should just kind of talk about it. They work for you.
You're paying for it. I think this is a brilliant idea to talk about because most of the time, I make my ugly noises when you say insurance because most of the time we feel like, oh, insurance are the people who are making our jobs more difficult or saying no to things. Yeah. But you are paying for this resource. I am super grateful for these companies in that this is our access to healthcare. Yeah. And this is something that you have purchased. So this is like you buy a new car, but you never read the manual. You never have a clue as to what this car does. You spent a lot of money on it. And then you realize, when you're ready to get rid of it, oh, it had a GPS in it. I never even knew. Yeah. Oh, it did all these things. I could go off-road and didn't even realize it. And so there's all this stuff where it's like, if you spend your money on something, why don't you want to understand it and know how to best utilize it? So, I think an easy is if you just look at your vision insurance, because it's not so convoluted. Most of the time, people who have vision insurance, especially if they have glasses or contacts, they know exactly. I can get one new pair of glasses a year. I can have one annual visit and I can get this many contacts, or I can get glasses or contacts, but not both. They know what they're paying for, and that way they utilize it. Yeah. But if you don't know that, you're going to go the whole year. You're going to have glasses that are 3 years old, didn't realize you could have got a new pair every year, and you're wasting away the resources that you pay for. Yes. Also, I think it is super important, and I'm going to put this out there, and it's going to sound heartless, and I'm not, but I need people to understand our job is to take care of you. Our job as your doctor, nurse practitioner, is not to know what your insurance supplies you. Yeah. We deal with no less than 50 insurances on a regular basis, and we probably deal with hundreds of insurance across the board. Anthem Blue Cross Blue Shield is not one plan. It is 700 plans. Yeah. And the plan for this company is different from the plan from this company. So I think people feel like your doctor, your nurse practitioner, your medical providers should be able to get you what is going to be cheapest for you. I'm telling you, even if we want to, we don't have a clue. We could never know that. And what was covered last year on your plan isn't going to be covered this year. Yeah. You have to take ownership for this. You have to know. And I promise you, I will never write you a prescription for something expensive if you bring me your formulary book or you have access to it on your phone and you go, here's my tier 1 drug drugs, Dr. Plaster. Can you write from one of these tier 1 drugs? Heck yeah, I can.
Yeah, I'd love to, actually.
Yes, but when you don't know, and then we start doing the back and forth where you're like, it was $500. Can you try something different? Well, guess what? I didn't mean to charge you $500 for that one at your pharmacy. Yeah. I don't know what other one is going to be paid for either. So one of the things that you pay for is drug coverage. And in that drug coverage, you should know what's covered.
Yes, and there it is something called a formulary. And so now we used to get books in the olden days. In the olden days, our insurance used to actually mail us a copy of our formulary, but now it's online.
It's online.
And it's you can just put that in the Google, or you can go to your plan's website. And
while you are sitting in the lobby of your doctor's office going, why do these people always make me wait? You could start pulling this up on your phone. You could be like, I know exactly where my formulary is on this phone.
And a lot of insurance companies, like ours has an app. And so I have some patients that'll just pull things up on their app and say, hey, this is what, this is my formulary. And so that is
I'm
helpful.
thrilled for someone to go, can you give me a second, see if that's covered? Because I would rather take a second with you in front of me to figure out what indeed you can access than later that night when I'm home with my family to be putting through a second prescription and a third prescription because the first one wasn't covered.
Yeah.
Yeah. So I think having access to your formulary, knowing that you need to take ownership for what your drugs are going to cost. And if you want a cheap med, tell us which ones are cheap.
And on their insurance card often, because when patients are in the room with me, I'll say, well, where would you like for me to send this? And they're like, we don't know. And I'm like, well, what's your preferred pharmacy? And they're like, we don't know. Often on your insurance card, if you flip to the back, and sometimes on the front, it will have like the preferred pharmacy. It'll have the mail order pharmacy. It will have a pharmacy line number and a nurse line. And when I have had patients call them, they're usually very helpful. The pharmacy line will help you navigate drug use and cost. And people may not realize, but there are contracts with insurance in certain pharmacies. So we have Blue Cross Blue Shield, and our contracted pharmacy is CVS, and the mail order is CareSource, and that is just, I think it's called CareSource. I don't use it, but that's
Caremark, I think
Caremark.
Yep.
Caremark. And so I think there is a CareSource too, but I don't know if it's Blue Cross Blue Shield because who knows. But there are preferred pharmacies, and so you may go to a Walgreens and something may not be covered as well as if you went and got it filled at CVS. So
and they may not cover it at all. So now I've sent an antibiotic that I want you to get started on right away to Walgreens because that's where
you think you're going to go.
I'll go. And then you get to Walgreens, you wait in line, you spend half your day, and they go, guess what? Your insurance won't pay for it here. So then you have to contact your doctor's office, and then you have to wait for me to finish seeing all the patients that are in front of me to send it somewhere else. Before you go to the doctor, do your homework.
Yeah.
When you get a new insurance, talk to your HR people or just jump online and read about your plan. It's like reading the manual for your car. And know this is the pharmacy I have to use. This is where I access my formulary book. This is what's paid and what's not paid. Mm-hmm. This is all the things that they'll do. This is what it's going to cost me. I think in general, people are very confused as to the cost. We get accused of doing some sort of fraudulent insurance stuff all the time. And because they're like, you charge me $30. I'm like, no, you have a $30 copay. Your insurance charges you $30. And then the insurance pays the rest of the visit. And so I think knowing those kind of things will allow you to come to the visits equipped and know what your out-of-pocket cost is going to be.
And sometimes when my dad was really sick, I told my mom, I said, you need to call the insurance and you need to find a nurse and you need to become friends with that nurse.
Yes.
Because my dad was a diabetic and like diabetic supplies get expensive. And he could enroll in a plan with his insurance that if he talked to the nurse and talked about his diet and exercise and what his blood sugars were, then his diabetic supplies were free. Mm-hmm. And so I was like, well, you need to be really good friends. And so my mom became friends. Now I can't remember the sweet girl's name, but my mom and her were friends. She talked to her once a week trying to get my dad to navigate because it gets expensive when you're having.
And these nurses work for the insurance company. They know exactly what that insurance company can and can't supply. They have a lot of resources that they're aware of. And so when you're struggling to navigate, when you're like every single blood thinner that the doctor wants me to be on isn't covered, call the insurance company and talk to them about that. Yeah. And they can tell you, well, here's your alternatives. Or you get to the pharmacy and it's going to require a prior authorization. It's going to require a PA. You can call and talk to a nurse and say, well, what is this and what does that PA need to say? People will call us and say, they want you to do a PA. Well, one insurance company will say, well, you have to have failed these 4 medicines. And another one will say you have to have failed 2 medicines, but they have to be in these 2 different classes. So I can write 3 PAs and I might not meet your insurance's criteria. Yeah. But if you've called your insurance, particularly if you have a nurse advocate at your insurance, then you can call and say, this is, and we have patients who navigate this, and I appreciate them so much. I called the insurance. They said this is what would be covered. They said this is what needs to be in the PA, that this is what you need to state, and then they'll cover it on it.
Easy.
We'll get that done.
Yeah. Other things that they'll pay for is our insurance does it. So this is just me navigating and trying to look through the website so that I could prepare for this. But like they have webinars. They often will, if you complete them or if you sign up for some of their like wellness like challenges, like our insurance, I think it was like up to $200 that they would put on like a little debit card that I could use for other things. Like you were mentioning contacts and glasses. So I could use it in other facilities or to buy vitamins as long as I kept the receipt. So there's all like, it's similar to not really an HSA, but like a reimbursement type of thing where you can complete things and then it helps pay for other wellness things.
They want you to be healthy.
They want
you to
be healthy.
Saves them a lot of money.
Yeah.
And in that as well, getting your annual wellness visit. There are often incentives for getting your annual wellness visit, and there may be some punishments for not.
Yeah.
And so, you know, they could charge you differently for different things. We get lists sent to us.
Oh, we get lists?
Here's United Healthcare's list of people who haven't had their annual wellness. Here's Blue Cross Blue Shield's list of
They've
people.
not had their colonoscopy or their pap smears.
And then we call people and we say, we would like for you to have your annual wellness because we feel like we can prevent illness by doing that. Your insurance would also like you to. And I don't know if, you know, what happens with your insurance company if you don't. I honestly don't. So I would say understanding what those incentives are. You know, my dad has a Medicare plan. He's on a Cigna Medicare plan, and he gets so much money that he can spend on that plan on things like over-the-counter medications. And if he's not on top of that, it's like $250 that he would have to spend at the pharmacy.
That's a lot of money.
It's a lot of money. And so he goes shopping and gets what he needs.
He's
and they
like,
send
here's
it to
my vitamins,
he goes online.
Cigna.
Exactly. He goes online, he buys it, and they send it to the house. And now he doesn't have to spend that money elsewhere. But if he's not staying on top of it, he's just going to let the year go by. He's not going to use that advantage. He's paid for that. Yeah. He needs to know it, stay on top of it, and use it.
A couple of other terms that patients have asked, like it's explanation of benefits. So sometimes it's not a bill. It looks like a bill, and it will absolutely freak my patients out.
I wish they could just stop doing that, but they don't. They're going to do it. So an explanation of benefits is when the insurance sends you a letter and it says, more or less, we are explaining to you what we paid. And it will often have on the bottom, it looks just like a bill.
It looks
on
just
the bottom,
like a bill.
0 or 25 or whatever. But if it comes from your insurance company, you're not paying this to your insurance company. They're letting you know that this is what we've paid to the hospital or the doctor's office, and this may be what comes due to you. But what you're waiting for then, so that's just a little FYI. That whole explanation of benefits, EOB, it's an FYI. Then you wait for a bill from the hospital or the clinic or wherever else, and then that's what you actually have to pay.
Yeah.
So if it says Our Family Health at the top, that's a bill. If it says Blue Cross Blue Shield explanation of benefits, that's not a bill. Yeah. That's just prepping you for, hey, we want to let you know
that
what we
often
paid.
Will evoke fear in patients.
It does. It bothers people.
And
they shouldn't make it look like what they do. They could fix that.
They could fix that. And then other things that you have preferred providers often or out-of-network providers. And so that's something that you would want to look at and make yourself familiar with because, you know, on certain plans, we're preferred providers where you pay less to see us because we're in contract with the insurance company. And then there may be somewhere else or some insurances that we're not. So,
and there's some ridiculous BS that goes on with that.
I love how you just start.
There's just no way around it except for to just say it like that, because you can have a preferred hospital that's in network, but then the doctor at that hospital is not in network, and people get really upset with us, like we did this somehow. A doctor may see patients at 10 different hospitals. A surgeon may operate at 5 different hospitals, and so every insurance that hospital takes, that doctor may not be in network with. And so you really have to ask a little bit further.
No, of course, in an emergency situation.
In an emergency situation, you don't have this option.
You don't have the option.
But I do think you can call your insurance afterwards and say, this was an emergency and I had no ability to navigate this. I went in at 3 a.m. This was the doctor that was there and they saved my life. And so how are you going to work with me on this? Yeah. However, if you're having an elective surgery, then you want to ask, is the anesthesiologist in network? Who will be the anesthesiologist? You might never meet this person. Who will be the surgeon and the hospital? And are all of those in network? Otherwise, you could get a surprise bill.
And it sounds very complicated, and it is. But you're paying for this, and I always tell patients, like, know what you're paying for.
Because you have to understand
some of it honestly can be helpful to you, and you can get things from insurance, like you said, because they want you to be well. And if you're navigating it, it makes things a lot easier when it comes time.
And you have to advocate for yourself with this.
Yeah.
We have a complicated healthcare system. It just is. I wish it wasn't. We work in it and we don't understand all of it. And so you have to become a student of this stuff in order to be able to advocate for yourself, because otherwise you're going to be fighting this on the other end and you get a big bill when it's really, if I would have just gone to had that same surgeon, but gone to the hospital 10 minutes the other direction, I wouldn't have this bill. Yeah. That's a question you would have wanted to ask in advance. But unfortunately, a lot of people don't know to.
Yeah, and I think, like you mentioned earlier, sometimes patients get frustrated with us, and honestly, we don't know either. Yeah. And it's something that you're paying for, so we want you to be well versed, and hopefully this is a little helpful, like just little tidbits, like on your card.
Whatever time of the year comes for you, and it's not always January when insurance changes at your employer, you should take very serious, okay, we have this insurance plan. Where do I find information about that insurance plan? Here's the website. Let me go on that website and read on it. So that one night when you get your new insurance plan, you are not going to get on Facebook or Instagram.
That's right.
That one night you are actually going to get on their website and you're going to read and you're going to empower yourself to know. And you're not going to come look at us or whoever your lovely medical provider is and expect us to know, because as much as we want to help you with as many things as we can, we don't know this stuff. Yeah. We can't. This is not something we learned in all of our education, and it changes and it changes. So then you know what to ask for, you know how to navigate it, and you're going to get the most out of it.
And sometimes I can say, ask your insurance this specific question.
Yeah.
And so that's about the only way I can help, is like, hey, I have no idea, but this is what you need to ask. Like, you need to call and ask this specific thing. And so we are more than happy to do that. And
absolutely.
But you're paying for this, and we want you to be educated, and we want to help you be educated. So hopefully this is a little helpful.
Yeah. And knowledge is power. And unfortunately in this arena, a lack of knowledge can be extremely costly. Yeah. It can be extremely costly. So please do your homework and know your insurance. We like to leave you on a good note, so here's today's Tell Me Something Good. Something good is a sense of humor. Sometimes life can be hard and we need to not take it too serious. Have a laugh, lean into the people who make you laugh, and really try to keep a sense of humor. Thanks for joining us, and until next time, take care of yourself.